Managing exacerbations. Home management incorporate the four components of care include assessment and monitoring, patient education, environmental control, and medication. Recognize early signs, symptoms, peak expiratory flow measures that indicate worsening asthma. Adjust medications, increase short-acting beta-2 agonists, and in some cases add oral systemic corticosteroids, and remove or withdraw from the environmental factors contributing to exacerbations. Monitor response and seek medical care if there is serious deterioration or lack of response to the treatment. Management in the urgent or emergency care setting. Assess the severity, treat to relieve hypoxemia and airflow obstruction, reduce airway inflammation, monitoring response, discharge with medication, and patient education, assessing initial severity by lung function measures for ages 5 or older, and symptoms and functional assessments. The patient may require supplemental oxygen, repeated or continuous short-acting beta-2 agonists, oral systemic corticosteroids, monitoring response with serial assessment of lung function measurements, pulse oximetry, and other symptoms, considering adjunctive treatment, magnesium sulfate or Heliox in severe exacerbation, and unresponsive to initial treatment. Provide at discharge medications like short-acting beta-2 agonist, oral systemic corticosteroids. Excuse me, I'm sorry. Consider initiating an inhaled corticosteroids. Refer to follow-up care, an emergency department asthma discharge plan, review of inhaler technique, and whenever possible, environmental control measures. Some differential diagnostic possibilities. A differential diagnosis of asthma should be considered. Recurrent episodes of cough, wheezing, most often are due to asthma in both children and adults. However, other significant causes of airway obstruction leading to wheezing must be considered in the initial diagnosis, and if there is no clear response to initial therapy. Additional studies are not routinely necessary, but may be useful when considering alternative diagnosis. Infants and children, upper airway, allergic rhinitis and sinusitis, obstruction involving large airways, foreign body in the trachea or bronchus, vocal cord dysfunction, vascular rings or laryngeal webs, tracheal stenosis or bronchiotinosis, enlarged lymph nodes or tumors, obstruction involving small airways, viral bronchiolitis or obliterative bronchiolitis, cystic fibrosis, bronchopulmonary dysplasia, heart disease, other causes, reoccurrent cough not due to asthma, aspiration from swallowing mechanism dysfunction or gastric reflux. For adults, chronic obstructive pulmonary disease, COPD, congestive heart failure, pulmonary embolism, mechanical obstruction of the airway, pulmonary infiltration with eosinophils, cough secondary due to drugs, and vocal cord dysfunction.